So my name is Zahara Batool. I'm working as lecturer in urban systems at Institute for Transport Studies, University of Leeds. And Vitalize, or if I explain it, visualizing active travel with Pakistani families living in Bradford. During the project, I have incorporated a technique called Photovoice to understand Pakistani community concerns related to walking and cycling. And I have also assessed whether Photovoice as a tool was useful to bring or enhance that understanding, and also up to an extent influencing people's behavior. So I was always interested to know that, okay, first of all, why we are not meeting our net zero targets when it comes to active travel, but also are there any variations? So for instance, the focus of my project is BME community in England. So sometimes the understanding is at a very superficial level. So this project has enabled me to go and see what people are thinking. Are they ready for change? And also what we can do to bring that change.
Yeah, and in your project, you talk about how gendered the experience of being able to engage in active travel is. That was one thing that I picked up when I was reading it. Could you say a little bit more about that?
Yes, again, this is something which I found quite interesting. So, being a researcher, although you should avoid starting a project with some preconceived notions, but generally, when you think about Pakistani heritage community, you think that you come up with this idea that there are going to be some gender influences, um, which are true for this project as well. But then, how gender influence at different stages of life and among different generations is something which is very striking for I have found out in this project. So, for instance, um, to understand the barriers, especially for Bradford community, it is important that we look at community from three generational perspectives, Generation X, Millennials, and then Generation Z. So what I found out is that for Generation X, or we can say it, that the people who first come to Bradford from Pakistan, uh, in that age group, females are less active compared to male members of the family. However, when you move to millennials, things have changed. So now millennials is the group of people who were born and raised in Bradford or in England. So they were more immune to the system, and they were culturally more aware, and also they had better access to facilities compared to their parents or grandparents. Now, if you look at this group, you will see that females are the ones who are making change happen compared to male members. And we will look into the, reasons why is it so. But with that change or the willingness to change, they have to face certain barriers. Again, it is true even at this point. And those barriers are mostly, apart from being faced with some personal issues, it is also linked with some social barriers and the fear of getting or being judged by other members of the community. However, when you move to the third generation or Generation Z, things have again changed. And this time, according to project or what I have learned through the project, is that compared to females, male are more vulnerable when it comes to, car dependency or moving towards active travel. And again, this time, peer pressure is affecting young boys, especially. They are expected to behave in a certain way, and they are expected to uh, keep, fancy cars. So things are different at different levels. So yeah, gender is quite pronounced. And this is, and I guess if we have to address the challenge, we have to address it by keeping in view that which generation we are looking at.
What was the most surprising thing that you found?
So Monica, I think for me, because as I said in the beginning, that I was quite interested in finding out what is likely to work. Okay, so the first thing is that I have learned is that the community is ready to change. despite the fact that whatever barriers are there. So this was like, I guess, the most positive outcome I have, got. And they're willing to change because of so many reasons. But the key ones are that because of the poor health issues, millennials have seen their parents struggling due to diabetes and due to obesity. Generation Z is anyways aware, have this high level of awareness because of the education they are receiving or all the interventions which are happening at national level and regional level or even like at local level. Apart from that, what is also striking is that I found that integration is quite important. And when I say integration, it's like community integration. So integration of BME community with white community. And that was, I guess, the most important finding of this project because I have interviewed 8 households. And I guess all of the households, or at least 7 I can straight away think of, directly said that them being around white people or white English people helped them think differently. So they have said that the people who were actively walking compared to those who were not, they said that this has happened because either they have joined some walking groups led by white community members, or it is because they are inspired by their, the way their neighbors do walking and cycling. So the influence of white community is huge on the community and in a positive way. And it encourages them to see that an older lady taking a dog out for walking. So all these things are really important to them, and they have seen these things. They have experienced that how it helps to stay active and healthy till a very late stage in the life. And I guess this is one of the most important factor which we can capitalize on if we
Yeah.
want to bring change.
If the community is ready for change, what are the barriers?
Okay, so barriers could be listed or categorized at the 3 or 4 different levels. So first of all, it is personal, then social, environmental or local environment related, and then obviously on top of that you can say wider factors. But if we look at a personal level, again the understanding varies across different generations. But car dependence is mostly linked with some short-term rewards and biases. So I'm using car because it is saving me time and it is efficient or productive use of my time. And this is mostly relevant if I am from millennial or this working age group, and I have, 2, 3 children, and I have to manage I have to do school run, I have to do 9 to 5 job. So this is the most important thing. But some other factors are related to my agency, or if I'm somebody who is 60 plus, lack of motivation or my control over or my perception about my ability to walk. And that is linked with illness or again obesity or I haven't experienced walking. So I think I don't have that capacity to take walks, especially for shorter journeys. This is one another factor. Then parents, they are concerned about sending their kids, letting them walk on streets because they think that kids are not streetwise. And COVID has influenced that perception more because now they think that because kids have spent so much time on screens that their interaction with real life scenarios are quite limited. So these are some of the personal barriers. Moving to social barriers, again, as I have said, if I'm female, I may fear that some of my community members, my own community members, would judge me that why I'm going alone or at this particular point of time. It is different if if I'm an old falls under a category of being, older. So then it is different. Then there would be less judgment, and people would understand that okay, I may be doing it because of health reasons. But then social barriers are also about what other people might think about, the choices I'm making. Why I'm not using car? Is it because I can't afford it? Is it because, I have a certain kind of mindset which doesn't go well with rest of the community. But when I say that, I must say that in inverted commas, that what is happening in Bradford is that many people are now taking walking very seriously. They are still the distance to come to cycling is, we still need to cover many barriers before we can go there. But for walking, this is happening. But what is the problem is that there is no realization or lack of realization that walking can be a part of everyday journeys. So you don't have to go to Leicester Park or Peel Park in Bradford to meet your daily mobility targets or active mobility targets. You can also incorporate those walking steps by taking short journeys to your grocery store. There are some areas in BD3 or BD9 where participants have said that these areas needs improvement. Girlington or Manningham, for instance, are the areas where uh, littering is an issue, fly tipping is an issue, um, poor or short or very small sidewalks, no space for walking is an issue. Very tight road lanes is an issue. Parking on street is an issue. So in terms of place-based solutions, what is important is that the council itself and obviously other stakeholders need to bring uniformity in the level of development and the kind of facilities they are providing. And it has to, so the better off areas and relatively less affluent areas should come, there should be some leveling ground so that people don't have to travel all the way to certain area of the city to walk or cycle. If local areas are in good conditions, people can do that. And these areas which I have mentioned are the areas which are closer to city center. And there are 3, 4 main roads. If council and can look into it, I think there is a potential that we can see huge improvement.
Yeah, tell me a little bit about the Photovoice methodology that you used. How did that work, and how did that help you understand this better?
Yeah, so in simple terms, photo voice is just taking photos or capturing, scenarios and which influence you in any way. So for this project, um, I have designed it in a way that I wanted my participants to think about two things. So it was a 2 weeks project or commitment when I have started collecting data with the participant, and I asked them that help us identify barriers which put you off or would encourage you to walk or cycle. So in week 1, I asked them to just think about the reasons why they are using cars. So the motivation or the rationale behind was that I wanted to increase their consciousness level and I wanted them to think why they are using cars. And then in week 2, I have asked them to now think about factors that can encourage walking and cycling. So again, this was giving them an opportunity to highlight those barriers and to look at things from this angle that, okay, what is missing in the environment? So they have collected photos, and during this process, because of I made them think about the choices they are making. So when I have collected feedback, they said, and sometimes I didn't even need to ask them that, what do you think about the project? It was, without any prompt, they come up and told me, you know what, this has made us think that why we were using car. And or just because you have asked me to take photos, the other day I decided to take a walk because it is important for my health and well-being. So just, triggering that thought process, this is what Photovoice has done for us. I have worked with Department for Transport, Transport for North, Capital of Cycling, which is a local or charity or NGO working in Bradford, and also with Bradford City Council. So all my, partners or collaborators, they have helped me design the project. They have helped me. So Bradford City Council, for instance, they helped me in recruitment. They have helped me to build up my initial understanding. So apparently you can tell that I am also, from Pakistani origin. But the thing is that I'm not native here. So I don't understand Bradford as a researcher or as a local. So these collaborations actually help you gain better understanding. So I guess this is very important. And then the collaboration with Department for Transport or Transport for North, not only they have helped me design my like theme or the prompts, but then they have also given me some valuable feedback. And it's not just that they have helped me, but through this project, I have also helped them to understand, what is happening at local level. So this is like a win-win situation for all the parties. So I guess close working with the community, but also with the people who are relevant and who have stakes. It's very important that you engage them and you engage them even before you conceive your project, to be honest.